everyone, it's Marie Behenna here. If you have been to my classes, you will have learned about how you can use the diaphragm to help any kind of pelvic health problems that you might be having, such as prolapse or bladder weakness, or just poor function of your pelvic floor. But today we're going to focus more on how the diaphragm can help your bladder problems. So your diaphragm is situated underneath your breathing apparatus, so your lungs, and it's connected to your pelvic floor through very many lines of fascial tissue and all sorts of other connective good stuff that keeps our core safe and functioning. So I'm going to draw you a little picture so you have a fair idea of what's going on. This is obviously not going to be any Tony Hart kind of imagery. So imagine this is your spine, sacral joint down the bottom, and your pelvic structure here. Your rib cage is roughly here. Again, this is not exactly to scale, but it just gives you a rough idea. Your diaphragm sits underneath your lungs, and you have another, essentially, diaphragm down in the pelvic floor. Many beautiful layers of muscle here. These are all connected through other lines of muscle, fascial tissue, different types of muscle structure. Now, if you have a tight breathing diaphragm, you can probably guarantee that your pelvic muscles will be tight. Your pelvis will probably tilt out of alignment anyway. So when all of these factors are put into one situation together, it's usually a recipe for problems with the pelvic floor in many ways. So what can we do about a tight diaphragm? Well, the key is if we can keep our breathing diaphragm nice and flexible and teach it to stretch, the knock-on effect is that the same will happen down in this lower pelvic region as well. So all of the muscles of the core will benefit from paying attention to your breathing diaphragm. So I'm going to teach you a vacuum method. In some places you may have heard of this referred to as low pressure training or hyperpressive training or abdominal vacuum training. There are many variations of this theme. And I'm going to just explain how this works. So we're going to teach the diaphragm to turn into a parachute. So we want it to stretch, stretch, stretch into a much deeper version of itself. And hopefully, if your diaphragm is not too tight, what will happen is that your abdominal muscles will pull in and your pelvic muscles will be drawn gently out of the pelvic cavity. Now, you might wonder how on earth that will make any difference. What happens is most people have a very tight pelvic floor, usually from spending too much time sitting, from spending a lot of time driving, working at computers, watching TV. Just our modern life makes our pelvic floor tend to be pretty tight. So if you're trying to use your Kegels to fix any pelvic problems that you might be having, sometimes that can be a problem because you're already tight. So if you're trying to squeeze an already tight muscle, you're just exhausting it. So what we're going to do is learn how to stretch and release these tight muscles using the diaphragm, so that we can actually then benefit from any kind of Kegel exercise later on down the line if it's suitable for you. Now, I would always advise that you speak to a women's health practitioner or someone who specialises in pelvic exercise like I do, so that you can come up with the best solution for you. But this is just a guide to help you. So I'm going to teach you how to use the diaphragm to reduce the pressure in your pelvic floor so that you can start to get on the road to recovery. Okay, so in order to help our diaphragm stretch and to relieve the pressure in the lower abdominals and pelvic floor area, we're going to take 3 long breaths in through the nose, calmly out through the mouth. I'm then going to get you to block your nose, keep your mouth closed, and attempt to breathe in as though you are underwater. Obviously no air is going to pass your face at all. You're just going to keep that nose peg there to try and create the abdominal vacuum that's going to help pull everything in and lift everything up. Okay, so watch my practice and then I will break it down for you. So I'm going to pop my hands on my ribs so that I can feel the ribs moving. I'm going to go with 3 breaths. Here we go. So what you will hopefully have seen is that when I blocked my nose and attempted to take what's called a false breath in, a forced vacuum will have taken place. Now in true hyperpressive practice, you wouldn't need to make a really strong false breath in because your diaphragm would be so flexible, you would just go into a state of exhaling all the air, relaxing, and then a natural vacuum would take place. But for most people, their diaphragm is so tight that it's almost impossible for that to happen in the very beginning. So my recommendation is that you start to practice using the nose peg and keeping your face really relaxed while you go through the breathing process. Allow your tummy to be relaxed while you go through the breathing process. Use a sharp, powerful breath in to wake the diaphragm up. And keep the abdominals very soft as you calmly exhale. That's going to help you get the depth of vacuum. If you're finding that you can actually create that false breath in without blocking, that's even better because then we can keep your body nice and relaxed in various positions that you might have learned with your practitioner. So I'm just going to go through that breathing practice with you again one more time without using the nose peg. And I'm going to take myself into a strong position so that you can see this working. So I'm going to rotate my hands so that my shoulder blades are depressed. And I'm going to draw my chin in so that my abdominals are not overactivated. Okay, inhale through the nose and exhale 4, 3, 2, 1 and inhale and exhale 4, 3, 2, 1 and again big breath in and exhale everything, so empty your lungs completely, take yourself into apnea, and when you've emptied your lungs you're going to block your nose and then make that false inhalation. So really suction, 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 suction. Keep going, keep going, keep going, keep going, and breathe. Right, nice and relaxed. Big breath in through the nose. Exhale with a sigh. Good, and again, and out. One more, lots of power. Big breath out. Good, into apnea, make your vacuum. Squeeze your bladder, squeeze your ball, lift your toes, tilt your pelvis, float your arms over your head, thinking about your tummy drawing down to your spine all the time, all the way. And then back and slowly reverse. So relax your feet, ball, pelvis, and breathe.